begin, I think you probably heard me start just a little bit. So again, I really want to acknowledge my colleagues, Janelle Palacios and others who have helped to raise the awareness of the needs of Indigenous mothers and the progress that they have made to improve care. And I'd also like to acknowledge our colleague in the Division of Reproductive Health, the late Leslie Randall, in advancing this awareness as well. And I want to acknowledge the trauma and systemic barriers that are linked to disproportionately high maternal and infant deaths that many tribal communities experience. And yet, American Indian and Alaska Native mothers and communities persevere through notable strength and resilience. And there's still so much to be done, but I'm proud and humbled to be here with you today to share some of the work that we are doing to hear and talk to American Indian and Alaska Native mothers, their loved ones, and their communities. And in this presentation, I will just share more information about the Hear Her campaign and what we have heard from tribal communities and how we would like to move forward with the production of materials for tribal communities. The images and messages that I'm going to show you are all preliminary concepts that were based on what we've heard so far. And I'll keep my comments brief, as I'd like to hear from you about whether this campaign would resonate with the people that you serve, and how can we develop these resources to best serve tribal communities. So if you go to the next slide, thank you. Overall, each year, about 700 women die during or within 1 year of the end of pregnancy in the United States as a result of pregnancy or delivery complications. And there are considerable racial disparities. American Indians and Alaska Natives are 2 times more likely to die of pregnancy-related causes than white women. And most lives that are lost from complications related to pregnancy could have been prevented. Given the disparities that American Indian and Alaska Native people and communities experience, it is a priority for each of us to reach tribal communities with these resources. We honor the lives of those who have passed on and work to prevent future losses. Our division works to better understand the causes of pregnancy-related deaths and to apply that data to action. Data from CDC surveillance systems and field work inform the development of the Hear Her campaign. So in August of 2020, we launched the Hear Her campaign to raise awareness of potentially life-threatening warning signs during and after pregnancy, and to improve communication between patients and their health providers. So we do this by first empowering pregnant and postpartum women to speak up and raise their concerns, and by encouraging women's support systems to engage in important conversations with her, and providing tools, resources for providers to better engage in life-saving conversations. Now, we must keep mothers healthy and safe by ensuring that their concerns are heard and that they get the care that they need. In 2021, the Office of Minority Health provided funding to develop a segment of the Hear Her campaign specifically to reach American Indian and Alaska Native women and communities. And with that funding, we've been working with CDC Foundation, Market Vision, Gray and Gray, and the National Indian Health Board to develop this segment. So for the next few minutes, I'd like to share more with you about our approach to developing this segment of the campaign and what we've heard from American Indian and Alaska Native communities and our plans to develop resources. And then afterward, we'll have time for open discussion. And I hope that we'll all share your thoughts and feedback on our plans for this segment. Now, while there are many partners in this work, including each of you, mothers are the core of it. And we understand that historically, the nature of how American Indians and Alaska Natives view women with the utmost respect. And women not only give life to the tribe, but are the keepers of the family and the home. She is not only a mother, but a teacher and a storyteller who passes down the knowledge of the tribe. To create a successful campaign that is not just rooted in research, we must be conversational. We want to speak with women who are the carriers of the next generation. A conversation that will not only show the respect of who they are and where they come from, but the knowledge that when she speaks, she will be heard. We must create a story that extends to those who care for these women and then invites them into the conversation. This conversation is centered around each voice and the teachings that are embodied in that story. We're on a road together, and we will continue to be there as we want to get this right, and we want to make sure that the women we serve feel that they are heard. In 2021, we focused on better understanding what American Indian and Alaska Native pregnant and postpartum people, their support networks, and their healthcare providers need, and what messages and resources work best. We conducted in-depth interviews with providers who serve Native women, as well as focus groups with Native pregnant and postpartum people and their support people. And from these sessions, we gathered inputs on messages, images, resources that would resonate the most. We also learned about their perspective on the historical and current context of mothers' experiences with pregnancy and birth and the resources that they want and need. So one of the things we heard consistently is the importance of acknowledging the historical context and present issues that influence maternal health outcomes in tribal communities. American Indians and Alaska Natives' maternal health is impacted by the historical trauma of systemic racism, colonization, genocide, forced migration, reproductive coercion, and cultural erasure. And I'd like to note that we are developing these public health messages and resources with sincere respect for traditions around pregnancy and birth, with the intention of keeping mothers and babies healthy. Now, storytelling is the center of this campaign, and we want to amplify stories from tribal communities. The campaign currently shares the stories of 6 women who currently experience pregnancy-related complications, along with videos with messages from healthcare providers and stories shared on social media. The Hear Her campaign will bring forth voices of those directly impacted through firsthand testimonials told by American Indian and Alaska Natives. By sharing their stories on a national level, we will not only raise awareness, but also open up opportunities for dialogue among families and communities. And after our discussion session today, we'll incorporate the feedback that you all share with us and produce stories from American Indians and Alaska Natives. If you know people who are willing to share their stories about pregnancy-related complications, please ask them to consider sharing their story through the Hear Her campaign, and they can email hearher@cdc.gov for more information. We'll also be back in touch in a few weeks with more information about how we plan to produce these stories and are asking for your help to share this opportunity. In addition to sharing people's lived experiences, there are some of the guiding principles here, as well as key messages that we're emphasizing throughout this campaign. Pregnant and postpartum people know their bodies and can often tell when something is not right. Listening and taking the concerns of pregnant and recently pregnant people seriously is simple yet powerful action to prevent pregnancy-related deaths. Timely treatment and quality care can prevent many pregnancy-related deaths. Partners, friends, and family are important allies to make sure any health concern is appropriately addressed by a healthcare provider. And everyone has a role to play in supporting pregnant and postpartum people and preventing pregnancy-related deaths. And of course, it is essential that we raise awareness of the urgent maternal warning signs, which can be signs of very serious complications and require immediate action. While pregnancy-related complications can be difficult to talk about, it's important to learn what we can to keep pregnant and postpartum people healthy. Recognizing the urgent maternal warning signs, getting an accurate and timely diagnosis, and quality care can save lives. If we plan to develop a suite of materials to amplify the stories shared, raise awareness of the urgent maternal warning signs, and if we improve communication between American Indian and Alaska Native patients and their providers, the resources will be housed on a dedicated webpage that's part of CDC's Hear Her campaign website. And in addition to the testimonial videos, we'll produce public service announcements and digital and print resources that tribal health departments and others who serve pregnant and postpartum women can use. We recognize that reaching healthcare providers and ensuring that pregnant and postpartum people receive respectful and quality care is essential. Health professionals play a critical role in eliminating preventable maternal mortality. One part of the solution is to really hear women's concerns during and after pregnancy and engage in an open conversation to make sure that any issues are adequately addressed. As part of the general campaign, we have developed resources directed toward obstetric professionals, pediatricians, and other providers, emphasizing the importance of really listening. Some of these resources are shown here on the slide and will be available on the Hear Her website next week. In addition, providers who serve American Indian and Alaska Native pregnant and postpartum people should provide care that is mindful of all the factors that influence their patients' health and is culturally respectful. We plan to work with partners who also serve tribal communities to share trainings and resources that will improve the quality of care that pregnant and postpartum people receive. So those serving American Indian and Alaska Native women must understand why it is hard for people from these communities to trust healthcare providers, which could include experiences of racism, stereotyping, and microaggressions that have led to challenges in being heard or getting their needed health care. The history of forced sterilization and American Indian children removal policies has also impacted trust between patients, communities, and providers. And as we develop this segment, we will add resources for healthcare professionals on providing culturally appropriate care to American Indian and Alaska Native people and emphasize the need to build trust and relationships to patients. The resources we develop will also remind pregnant and postpartum people that they need to find a healthcare provider they feel comfortable with, even if that means seeking care elsewhere, and to speak openly so that they can get the care that they need. Our goal is for the materials produced to resonate with many Native American people across the country as possible, but with 574 federally recognized tribal nations, we understand it would be challenging to capture the breadth of tribal culture and heritage. As such, the materials will be developed with a theme for each region to allow more specific messaging by region. While we understand there is still variation within regions, this will allow us to share more culturally appropriate messaging. Themes and images used will reflect colors present in the natural environment for each region, and imagery that's more relatable for tribes within those regions. As mentioned earlier, we hope to produce stories from pregnant and postpartum people across the nation, and that their stories will represent a diversity of experience and backgrounds. In addition, we'd like to work with all of you to ensure that the materials we produce are relevant for your communities, useful for the people who support or provide care to pregnant and postpartum people, and are distributed through the most effective local and regional channels. So we're grateful to be working with the National Indian Health Board on dissemination of these resources. And after the materials are produced, NIHB will host a tribal health community to ensure tribal health departments have the guidance and support needed to implement this campaign. We'd also like to hear more from all of you on the best ways to reach your tribes and hope to work with you to amplify these women's stories and share the resources developed. We're taking the time to ensure we develop this campaign segment in the most respectful and effective way possible to reach the widest number of American Indian and Alaska Native mothers and people. Now I'd like to turn it over to you. Are there any questions or thoughts?
Thank you, Dr. Barfield and Dr. Montero, for that informative overview of the Hear Her campaign. We are now going to turn off the recording